So we're going to take a look at some ergonomics. First thing we're going to address is the standard sitting work desk kind of position. So we're going to bring Shayla in here with a chair. This isn't our best work chair, I apologize, but this will kind of suffice for now. It's perfect for Shayla, as you'll see here. One of the most important things we want to address when we're trying to use good ergonomics in our sitting, we want, as I mentioned, a stacked position. So Shayla's going to make sure her ankles, her knees, and her hips are all at 90-degree angles. So if your chair doesn't allow you to do this, if it's too high or too low, we're going to either need to boost it up, maybe use a pillow to sit on, maybe use a footstool, whatever you need to do. If you have an adjustable chair, that's a great thing to use. Also, if you have an adjustable chair, that lets you change your position throughout the day. I would never say that my chair is in my perfect position, I'm never going to change it. The more I do that all day long, it's changing my position without me having to do anything other than flick a little switch. So, 90-degree angles, this allows her knees and shins to be stacked over her foot. And if her hips are at 90 degrees, she is in a stacked position of her spine, neck is over shoulders, shoulders over hips. Okay? So Shayla's going to scooch forward a little bit here, and she's going to let her low back kind of sag out a little bit. When she's doing this, she is adding stretch into her low back tissues. This is not a bad thing, and in fact, for me, sometimes this is a relieving way to sit. When we're looking at this region, we all think about our sit bones kind of deep in the back of your buttock where a lot of your leg muscles attached to. You were not gifted these bones for sitting. That is not their primary job. However, if we are going to sit in a way that's ergonomically sound, that might be something to keep in mind. Now, right down here, if I sit up on my sit bones like this, I'm going to maintain a stacked position. If I start to allow that to slouch out and around, I'm going to add some stretch into the back of those tissues. Okay? Pretty simple. So, 90-degree angles, ankles, knees, and hips. The next big cue, scooch your sit bones to the back of the chair. Regardless of what shape your chair is, scooching those sit bones right to the back is probably going to let the actual back support keep you in the position you want. Next one, towel roll, super handy. Sit bones come back. If you have a bigger back of your chair, you're just going to scooch this down kind of right around your belt line. Okay? Doesn't have to be too firm. We don't want this to really hammer us open like this. But all it is an easy, adjustable, free back support. If you have a back support that you purchased in the past and you love it, that's great. If you are considering buying one, please try this first. This is free. This is adjustable. You can put it anywhere you want. Sometimes those back supports are pretty expensive and they just don't quite hit the right spot. So keep that in mind. Very easy. Keep it at your workstation. There you go. Next thing Shayla's going to do, if she is at a computer, we want to try our best to keep that screen at her eye level. Okay? At somewhere within about 15 degrees of eye level, up or down. Maybe 30, but again, if it's adjustable, even better. Maybe you can look up a little bit of the day, maybe you look down, maybe you look straight forward. Okay, we really want to just be moving. She could sit totally still like this, and 8 hours later, I guarantee you, she's still going to be sore and stiff. Okay, so with that, if you're on a laptop, that's going to be really challenging. If you can bring that laptop up onto your table, I would really recommend you actually work at the table instead of sitting on the couch or somewhere like that. And it's that simple because now it makes this achievable because you're at a real chair. The laptop, the one thing it's going to miss is support of the elbows and possibly your wrist. So if you're having wrist issues or elbow issues, what we want to consider is, does my chair have changeable armrest height? Okay? So one of the big things that can create pain in my forearms at my desk, of course, is using my keyboard. So is my keyboard in a position where I'm up like this? Is it in a position where I'm like this? Am I adding a lot of increased strain or usage through those areas? If I'm typing all the time, if I'm typing all day long, I'm using all those muscles through my forearm over and over and over. That in itself is going to be a big increase of load to that area. So that's something you got to work on. And micro breaks with some gentle stretching, it's going to be hugely effective to try to decrease some of that and improve some blood flow and also decrease some pain as you do. Okay, so I just take my fist, tuck it down, Give it a squeeze. I feel this at the top of my forearm. I'm going to hold this for at least a minute. And then I'm going to do the opposite fingers to the sky, give it a pull, and I'm going to hold this again for a minute as a minimum, both sides pretty frequently. Okay? If my elbows or my armrests are changeable, the other big issue that can create pain in my forearms is actually sustained stretch or tension on the nerves that leave my neck and go into my arm to my hand. Okay? If my shoulders are down like this, imagine you're hanging on to a weight that's way too strong, or your dog just yanked you on the leash, you are creating stretch and pull through some of those tissues. As that time goes on, they may start to get sore, and it may not always be there. You may feel some of this down lower in the arm or hand. So if I can change my armrests, I can spend some time with them low, some time with them neutral, some time with them rested up top. Okay, it may look a little goofy, but again, it's going to at least let me change the position of my shoulder blades throughout my day and decrease some of that stiffness that builds and some of that pain. Okay, we've talked about using the band. We're going to use the band to address that. It's a very easy way, really, really effective, and something I really recommend for that. So eyes level, feet flat, 90-degree angles, sit bones to the back of the chair, make use of your towel roll, and if your chair is adjustable, adjust it. Move that sucker as many different times as you can. Okay? So, next piece, we're going to talk a little bit about ergonomics of a standing position or a standing workstation. If you are in a skilled or sedentary standing workstation like an assembly line, it's going to be a little problematic. You need to try to keep yourself moving. One way to do so is swaying. So literally swaying side to side, front to back, stepping your feet left to right, keeping things moving. Okay? Bringing the shoulders up, spending some time with them shrugged, spending some time with them back, spending some time with them forward, just simply keeping things moving in that direction or in that way. Also, if you are able to change your workstation's height, that's really going to be the biggest thing. If I have to work like this all day, neck pain, shoulder pain, upper back pain is coming quite soon. If you're a sous chef or a line chef, or you work in a kitchen or an assembly line, that's a problem. One thing that could help, Shayla, why don't you put your hands out like this, like you're working on something on the counter. What I want you to do is keep your hands exactly there. Start putting your feet out wider and wider. A little more. A little more. Okay. So now, her hands that were here, her workstation that was there, is now here. She's changing her hips, she's moving her legs. I know it may seem goofy, but it's really that simple. If you have an adjustable workstation or you can talk to your employer about that, that's the first step. If not, change what your supporters are doing, okay? If we are lifting, our posture or our ergonomics in lifting, I'm sure you've all heard our biggest cue, bend with the hips or bend with your legs, not with your back. Shayla's going to show you what that looks like. This is called a hip hinge. Okay? When she hip hinges, Shayla's bum comes back, her knees bend, and then she bends a little at the waist, and the arms come down. She can't really do this sideways. Okay? So a hip hinge is going to go hand in hand with lifting from between your feet. If I have to lift an object repeatedly, I'm going to make sure that is right between the laces of my feet every time I go to pick it up. If I'm doing this, it's going to be problematic. Just simply picking that up, taking the step and putting it down is going to add a lot less of that rotation and that repeated movement throughout my day. So less strain on some of those tissues, less chance of back injury. Okay, what she's doing when she does this, she's loading, she's taking biomechanical advantage or using ergonomics or efficiency of her hip joints, knee joints, ankle joints. They are much larger with much bigger muscles than the tiny little joints between each of her vertebrae. We talked about these last week. If you weren't with us last week, I'll see if I can get you guys to see this here. All kinds of little joints in between the vertebrae. Very small, not a lot of movement between them, but as a whole, has quite a bit of movement. So if she's going to bend with a big bend in her back, go ahead. she's adding more load and movement into these areas than she is into her big, strong joints. Now, this may be relieving. If you have some back pain, again, this gives me a little bit of relief. That's fine. But if my workstation involves doing this or bending and picking something up 100, 200, 300 times in the day, that's probably going to be something I need to change and try to adapt to. Okay, so that hip hinge, bum back, pick up from the middle of your laces is how we utilize posture and ergonomics in a repeated lifting scenario. Okay? If you are someone who is sitting on the floor, maybe it's not necessarily employment right now, maybe it's with your small children, maybe you're babysitting, maybe you're painting the floor, maybe you're laying floorboards or pulling up carpet or something like that, we're going to need to try to change our position frequently. You're going to have to pick many different ways of sitting in order to keep this fresh and different. Okay, there's the problem with sitting on the floor is it's going to be tough to keep what we would consider nicer ergonomics through the spine for a long period of time. So you're going to have to try a few different ones. What you can try with a thick pillow or a couple of pillows, especially if this is at home, if it is at your employment, this might be something you leave there, is a kneeling position. Shayla's going to just kneel on here. And she can rest her bum on her heels if she needs to, if your knees are okay with that. She can come up like she was there. We call it tall kneeling. She can do a half kneeling like I am right now. Right? One leg is up, one leg is down. I can switch this as I need to. Now I'm in this position and I can change it. She can also utilize cross-legged, so we'll take a look at that. Really great way to stretch out your hips. I guarantee if you haven't been cross-legged since you were in elementary school, it's going to feel a lot different than you remember it. But this is a fantastic way to open your hips up a little bit. You might find it's really hard to stay upright there. So maybe that's something that's going to add a little bit of increased load to your low back. Maybe that's tough for you, but again, it's not a bad thing to try for some of this time. Another one, and again, if you are on the floor with infants or small children, you'll probably see them do this, and you may not have recognized it, and now you will. We call it the 90-90 position. So Shayla's going to hop into a 90-90 right now. And this is a way that your child, all children, unless there is a congenital hip issue or an injury, sit. And they'll actually move on the floor by rotating back and forth. And this is a lot tougher for us now than it was for your child. Shayla's kind of really focusing with those arms, trying to keep herself upright. If you see your child, quite small, just playing around on the floor, they might do this, go behind them, get their attention, they might just flip over like it's nothing. But what this does is allow you to stretch your hips out, okay? Develop your hip joint. Your hip is a ball and socket joint. Sitting and moving in this way as an infant is a really, really nice way to actually groove and move and load those hips. So why not try to keep it and use it a bit now? Because if you have some hip pain or low back pain, we're probably going to give you this for homework anyway. So, Shayla's up right now. If she needs to, she can put one hand down to rest. She can use a yoga block or a book or something to keep her a little bit more upright there. She can pop something under her bum like a pillow in doing the same, and she can switch this back and forth. But this is a little bit less taxing on the lower back or the torso, especially the neck and shoulders, than doing something like this. So really, really easy to do. Really awesome exercise to just open those hips up. We talked about that 5-minute routine. If you're sitting at a desk all day long, having this in your 5-minute routine a few times a day is phenomenal. Okay, you're going to cover all the ranges of both hips really quickly and easily. So, we're going to move on to some specific posture exercises. If you were with us last week, we're going to do a bit of an assessment because we always want to do that first. We don't know what I need to do or what I need to try unless I've tried to assess it first and figure out why I should try something else. So we're going to use one position as our assessment position. If you have a wall near you, you can try this. This is also going to be one of our most effective bang for buck posture restoration exercises anyway. It's called the wall angel. So Shayla's going to come back to the wall here. What she's going to do is start with her heels flat on the wall. She's going to put her bum on the wall. She's going to put her shoulders and her head on the wall. She's going to try to flatten her whole low back against the wall. And she'll notice that this is a little tough for her. So what I'm going to have her do is actually walk her feet out with her back and her bum and her shoulders on the wall still until she can get her back flat on the wall. So we're talking everything from here to here is touching the wall, and then the back of your head. Okay? If you need to bend the knees, you can as well, but that's going to tell us a little bit of information about some exercises we might want to try. Next thing, she's going to bring her elbows out to the side. She's going to bring her knuckles up towards the wall. Can she put her wrist, her knuckles and fingertips and elbows on the wall at the same time keeping her head and her entire back on the wall? Can you do that if you're trying this with us right now? What do you feel? You might feel some tension in the front of your shoulder. You might feel a lot of tension in your mid-back. You might feel that your wrist is kind of cocking like this because it can't quite get there. Okay? This is going to tell us where do you possibly need to work on? What might be helpful for you and where to go next. So the wall angel as an exercise, what Shayla's going to do now, she's going to use her core and her bum to tuck her back against the wall. So she's engaged through here. And she's engaged behind her shoulders and shoulder blade, pushing into the wall. And she's engaged in the front of her neck, tucking her chin back into the wall. Now she's going to slide her arms up the wall as high as she can without getting a sliver on our wood here, as long as she can still keep all of those points of contact: knuckles, wrist, elbow, shoulders, spine, bum, and head. Okay? And heels if you can, but if you had to walk them out, that's okay. So she's going to go up there and take a pause. She's going to take a great big breath in, and as it relaxes, she's going to come back down. When she comes back down, this is the most important part. She's going to keep this against the wall as best she can. You'll see she's struggling there. It's not easy. And she's going to drive her elbows in towards her back pocket. What she's going to feel with this is it's going to feel like her hands are kind of coming off this way. We're going to squeeze all those muscles back there and really pull in between the shoulder blades. Think kind of around the bra strap line region. That's where you're going to feel these muscles working. Okay? Shouldn't be painful. You'll feel stiff and tight. The more you do this, the better it is. So it's slow, it's repeated. This is probably one of the best ones to put in your routine if you're an office worker. So what does this tell us? If you had some trouble areas in this, not necessarily pain, but areas you couldn't get against the wall, you couldn't hold, we're going to move on to what to do next. So if it's my neck, if I can't get my head against that wall, I'm stuck in this position, I can't get back there, we're going to use something called a chin retraction. So Shay's going to turn here so you can see this. What she's going to do is tuck her chin back like a turtle. So she's not looking up or down. She's not changing the orientation of her face. She's just looking straight back. And she's going to use her hand to give a little bit of a push just until she feels some stretch in her upper back and in the neck. And then she's going to let it go. And she's not going to hold this for too long. It's more of a repeated movement. So you go there, feel it, let it go. Go there, feel it, let it go. And if you have neck problems, headache problems, shoulder pain, or upper back pain, this should be in your routine. Think 200 repetitions a day. It's super easy, 20 at a time, but numerous times in the day. Really, really simple. Okay? Next piece is going to be some stretching of the chest muscles. If you have a wall, that's great. Doorway works fine as well. What Shay's going to do is put her forearm on the wall here and step forward and turn her body until she feels a stretch through the front of her chest and shoulder. We don't want any pain in the very top of the shoulder, right up around here. No sharp pinching. She may get a bit of stiffness in between the shoulder blades. That's okay, that's really good. But we don't want any sharp pinching up through here. One thing you may find in this position is some tingling or numbness coming into the hand after a period of time. It's not a bad thing. We just don't want to hold that for too long. Okay? So if you get that, maybe 20 seconds after that, you're going to shake it out, switch sides, and come back to it. The more you do that, the less you're going to have some of this numbness, tingling sort of sensation. Okay? With the pec stretching, Shay's also going to work on pumping some blood into the muscles of her upper back that allow her to get open like this. Because this was the position, I couldn't get out there with the wall angel, I need to train those guys. Brings us back to our handy band that we keep at our desk. Shayla's going to do something called a wall angel. Sorry, not a wall angel, a shoulder W. Started with a W, my mistake. Just the W, sorry, not the shrug yet. So she's going to hold the band, thumbs out, palms to the sky. You can do this sitting, you can do this standing. She is going to keep her elbows tucked in, pull her thumbs out to the side. You might notice the shape of a W in her body and arms. She's squeezing in between the shoulder blades and back of the shoulders for a pause and coming back. And when you're doing this, again, this can be a great strength exercise if this is part of a training routine. But as far as posture goes, we're looking at using this many times throughout the day to pump blood and shorten muscles that are being overstretched. So Shay's going to do this as many times as she can. Good pause, and she's going to rep this out until it feels fatigue all across the back of her shoulders. Okay, phenomenal way to take tension out of the chest, upper back, and the neck. Really, really good exercise. Okay? The next one is our thoracic spine or upper back extension. There's a couple ways to do this. If you have your desk, if you're at your desk, that's a really good one. If you have a wall, that will also work. Your chair may also work as well. If you have a medium back chair, you'll have a seat. What Shay's going to do is put the top of the back of that chair right around her mid-back above the bra line. She's going to either put her hands secure behind her head or hanging onto the chair. She's going to let her body gently arch over the chair, allowing the chest to kind of come forward. You're going to feel some stiffness there. If it's too much, go very gentle, ease into it. If you are someone who likes to do some of these things at home, I would really encourage grabbing yourself or ordering on Amazon or something similar a foam roller at home. You're going to have to do this on the floor with the foam roller, so not always best for our workstation, but essentially just getting open through that upper back. Really incredible way to take pain and tension out of the neck and shoulders. So using the chair, the next piece would be on the desk or the wall. So what she's going to do is come over to the wall here, and she's going to face the wall. So Shay, I'm just going to have you put your hands or your forearms on the wall. Good, we'll go forearms to start. Good. She's going to move her feet a little bit closer to the wall, and she's going to start to stick her bum back, bending at her hips. Come back, back, back. Allowing herself to stretch out through the arm and shoulder, and allowing her upper back to dip into the wall. Do you feel some tension right here? Good. And she can take a nice big breath there all the way in and all the way out. And as she does, she's going to sink her chest closer to the floor. Okay? So from the side, it would sort of look like this. Again, if you have a desk, you can do this sitting. All you're going to do is wheel yourself back, rest your hands on the edge of that desk, and sink your upper back through your arms until you feel that tension right through this region. Hold for some deep breaths. Gently move into it deeper and deeper. Phenomenal exercise to allow you to get up against that wall and just get you out of that tense position that's coming down like this. Okay? When we're working with that, we have some muscles that help support that position. They are right across this part here. Really effective throughout your day. If you're just sitting, you can scoot yourself forward. If you want to stand up, that's fine. Shay's going to turn sideways and clasp her hands behind her buttock. She's going to squeeze her shoulder blades together. Right around the bra line, you're going to feel these muscles really squeezing. She's then going to drive her hands towards the floor. So this is extending that upper back, pushing the chest forward, but also activating these muscles, shortening them, and stretching these muscles through the front of the chest and shoulder at the same time. When she does that, it's going to be 2, 3, 4 deep breaths in. I mentioned micro breaks, 20, 30 seconds even. If this is a problem area for you and this feels good, this might be your whole micro break. Maybe you hold that position and you just take 30 seconds worth of deep breaths. And all of a sudden that upper back, neck, and shoulder tension just feels quite a bit better. The more you can use that, the better. Okay? Really, really simple. Last thing, when she had her back on the wall in our wall angel assessment, she had to walk those feet out. If I am having a problem with this, I want to work on my control through here, but also some gentle stretching through the hip flexors. If you've been someone who sits a lot and that's your workstation, this is an easy one for you. You can use big pillows. This isn't about jamming your knee into the floor. What she's going to do is tuck her pelvis back. We call it tucking in your tail by using her bum and her core muscles. And if she feels that stretch to the front of the front pocket area, she's okay there. If it's not that strong, she's going to start to shift her body towards her front heel. Should increase a bit of that stretch. If it's not too strong, what Shay's going to do is bring the same arm up as the leg that is down on the ground and bend away. Okay? So I'll show you from the front. Something like this, feeling that tension right through there. Okay? You can do this repeatedly. She's going to sink in towards the heel and back off. She's going to go to the side and back off, and she's going to repeat this quite frequently. Really easy way to loosen some of that up. If you give some of these exercises a try and you tried your wall angel assessment, try it again after, you might notice a pretty big change in how it feels. Okay, but again, the wall angel itself is an exercise that strengthens some of those muscles. So if you're finding that that's your assessment and it feels difficult, you got to be doing that a little bit more. So in general, of just our everyday stiffness from the desk, if you're not having problems or they're just a little bit of achy stiffness, soreness, because you're working at home now more than you used to be, some things I would really recommend, we call them controlled articular rotations, even easier, joint circles. Okay, we're going to do these very slowly and with intent, but Shay's going to do this with her neck first. She's going to drive her shoulders to the floor and keep them there. Tuck her chin down, and just like gym class in elementary school, she's going to slowly bring that head all the way through this range. It is okay to go back, okay, if it's not painful. So if there's pain, jamming, or tension, you just shrink the size of your circle. So she's pretending she has a pen on her chin, and she's drawing as big a circle as she can, as slowly as possible, without any pain through the movement. She's moving every single joint in her neck right now, pumping the fluid that's in those joints, loosening things up, good stimulation, improving blood flow, decreasing tension and pain. Super simple. Next thing I would do with this is going to be the shoulder blades. Really simple. She's going to keep her hands tucked in tight to her sides. She's going to do some shoulder rolls. So she's going to shrug all the way up, really hard, really firmly up, squeeze the shoulders back, really firmly squeeze, drive them down, really big squeeze down, and drive them forward. Okay, so 4 points of that movement in a circle, exceptionally slowly, repeating until you feel some fatigue of the muscles around the neck and shoulder blade. It's that easy to take some of that tension out of there. Pump blood into the muscle, decrease some of the stiffness in the joint. The upper back as well, easy one if you're sitting and upper back pain is a thing for you. She's going to do similar to the head movement. She's going to give herself a hug. She's going to squeeze her bum and take herself for a full roll here, tucking her shoulders down, not all the way forward so she's moving in her low back, just a little bit so she feels it through the upper back or in between the shoulder blades, and doing a full circle without pain, repeating both sides, again, 10 times maybe, depending on how much time you have. And the last one, if you are a seated person and you're getting a lot of hip and low back tension, she's going to do some hip circles standing. Easy thing for you to do at your desk. Stand up from your desk, grab a sip of water, hang onto your chair, and away she goes. The knee comes up as high as she can, out as far as she can. Foot's going to twist, coming back, all the way around. Now what she's going to try here is as little movement as possible through her body, so just her hip is moving. It's going to shrink the size of the circle quite a bit, but it's going to make sure that hip's doing all the work. So she's pretending there's a pen on her hip, and she's frozen on her knee, and she's frozen everywhere else. So she draws a circle with that knee as slowly as possible in both directions, as many times as you have time for. Healthy hips, healthy low back, less stiffness when you go to get up. Big one that's going to be a kind of a staple in most people's program if they're a seated office worker or have a seated workstation is a back bend. Covered this last week with our low back pain. Shayla's going to turn sideways here. You're gonna, again, this is similar to that chin retraction. This is a 200 times a day kind of thing. She's giving a little bit of gentle push with her hands. You'll notice that her hips are traveling forward, okay? Not into pain. She's finding stiffness, pausing, and backing off. That's it. Find the stiffness, discomfort, back off. She can move her hands up a little bit and find where different stiff spots or sore spots are in her back. Adding a little bit of extra oomph with the hand at that certain spot. Okay, you'll notice as you repeat these, it starts to loosen up and loosen up and loosen up. If that feels good for you, 10 or 20 at a time, numerous times in the day, goes a long way decreasing hip tension, hip pain, low back tension, low back pain, okay? And my last tip and tricks or stretch position, if you are working from home right now or you are a desk worker, one of my absolute favorites, keep a thick pillow at your desk or with you right now. If you don't have knee problems, this is a good one for you. If you do, I apologize. We can try and look at some different situations. But I can now utilize my kneeling position while I'm working at my workstation. Couple minutes here, couple minutes there, couple minutes there, and repeat. The knee doesn't get too sore. I'm stretching the hip a bit. I'm offloading my back. I'm keeping active and keeping those hips moving. Really, really easy, okay? So, if you are concerned with overall posture, you know, maybe you feel you're too hunched forward, you want to be more upright, or you want to work on the appearance of posture, we want to think big bang for buck. Okay, and again, your posture is a snapshot of how you've spent your life. So if I'm finding myself rounded down, or I get tired from being upright or standing too much, we're going to look at strengthening or building the endurance of all the muscles through the back. Shayla's going to hop face down here, and this is called the Superman. It's super easy. It's pretty super. What she's going to do is squeeze her bum first, lift her knees about a centimeter off the ground, thumbs to the sky, lift her arms about a centimeter off the ground. She's going to feel every muscle from the back of her heel to the back of her head. This isn't about rounding all the way up to the ceiling. This is about getting long. We're pumping the muscle or blood into the muscles. So she's going to do this 5 seconds, down, 5 seconds, down, 5 seconds, down, and repeat and repeat and repeat until she feels fatigue in those areas. If you have a little bit of achy stiffness in your lower back, try this. If it's not painful on the first rep, do it until the muscles feel sore. When you get up, let me know if you still have that achy stiffness in your lower back. Just pumping blood into those overstretched fatigue muscles. Okay? Really easy. On the flip side, literally all the muscles on the front of the torso help to keep me upright as well. It's going to be our plank. There's a ton of variations of the plank. Shay's going to show you the main one right now. She's going to come fully up here. She's squeezing her bum. Her back is flat, and she's driving the floor away with her elbows, so she's not sinking into her shoulders. She's using all the muscles through her front of her hips, front of her shoulders, front of her core. She's breathing. She can hold this for anywhere from 10 seconds to 2 minutes and repeat. This is not easy. This is a tough one. If it's a little tough, drop down to your knees for me there, Shay. Perfect. Now she can do this from a kneeling position. Same thing, she's squeezing through her bum. It's a little bit easier. We're just trying to get some blood into those muscles, wake them up a bit. Adding both of these with the wall angel and with the shoulder W into your daily routine is a phenomenal way to just globally work on improving some of that posture that is maybe starting to give us a snapshot of our lifestyle that we aren't super happy with. Okay, not that it's a problem, but if you're concerned about something in that position or your posture looking like that, utilizing those exercises on a daily basis is going to help to build the endurance of the things that get you out of that position.